So this video is about Century Therapeutics, which is publicly traded with the ticker IPSC. CenturyTX.com is a website, and they are working on a possible cure for type 1 diabetes. So here was a Seeking Alpha article from February of 2026, and it says Century is positioned as a leading contender in developing a durable, one-and-done cure for type 1 diabetes using its hypoimmune stem cell therapy. So that's very exciting. I had done a video earlier about Sana, and Sana has a ticker symbol SANA with the website sana.com. And if you have type 1 diabetes, what happens is your immune system destroys your beta cells in your pancreas. So you can't make insulin, and you have to go on insulin shots basically the rest of your life. So Sana came up with an idea. They said, let's go ahead and put in some genetically engineered beta cells that will replace the insulin, but where you don't have to take immunosuppressant drugs. And you really don't want to take immunosuppressant drugs long term because they do have a number of side effects. So how is Sana working on this? Well, the first step is they do a knockout for MHC1 and MHC2, which prevents attacks from T and B cells on the beta cells. And then they overexpress CD47 on the beta cells, and that helps to prevent the natural killer cells from destroying these beta cells. So again, you wouldn't have to use immunosuppressant drugs. Now, Century has a similar approach. They also delete they call it HLA1 and HLA2 for the T and B cells, but then the next step, they insert a CD300A taser pan natural killer cell inhibitory ligand so that the natural killer cells won't attack the beta cells. So here was an article from Blood Advances, and this was January 2025, and they talked about a new category called trans-antigen signaling receptors. And this CD300A taser is the one that they were working on for their genetically engineered beta cells. And they found that the CD300A taser outperformed some of the other ligands, including CD47, as far as protecting the beta cells from these natural killer cells. So Century Therapeutics thinks they may have a really good solution here. They have an optimized CD300A taser in combination with the HLA knockout. And again, then you won't have an attack of your immune system on the beta cells. And your beta cells will produce insulin, but you won't need immunosuppressant drugs. That's the hope. So they did try it in mice, Century did, and it worked for over 4 months. The beta cells were not destroyed by the immune system. No immunosuppressant drugs were needed, and it showed pretty good duration of effect. They also injected some of these beta cells that were genetically engineered by Century into the capsule of kidneys and took a look at them at 90 days. And again, they continued to produce insulin and did not show any signs of excessive cell division. So the immunotherapy drugs were not needed to protect the transplanted stem cells, stem cell derived beta islet cells. And that's a big checkpoint, both for Sana and for Century. And then if you look at the pipeline for Century, they've actually prioritized their diabetes program. That's their number one thing that they're working on. They have other programs that work on similar technology for autoimmune disease and oncology, but the priority program is this type 1 diabetes program because it's a huge problem around the world. Now, cadaver cells are not very easy to come by, so the best way to get the beta cells is to make them from stem cells, and it takes about 29 days. Kind of a slow process, but you have to take the time to do this, and you need a manufacturing facility to do that. And Century does have a manufacturing facility that does that. So they'll start out with the stem cells, take it through the slow process of turning them into beta cells, and then genetically engineer them the way we described. So as a result, their end drug is without systemic immunosuppression. It also protects the cells from immune rejection, both T and B cells and natural killer cells, and it's also scalable. So it could be used on a lot of the people with type 1 diabetes. Now there was one thing that I was wondering about. Sana transplants their genetically engineered islet cells into the forearm muscle. So we know that that is their approach, but where will Century transplant their islet cells? Will it be in the arm? Will it be through the portal vein? Will it be somewhere else in the body? It's hard to tell from the website what the route of administration will be for Century. Century says that they have an IND planned for 2026 with initial clinical data in 2027. So they'll have to start off with phase 1. Again, this is a very early company, but you can expect some progress in 2026 and 2027. So I'm hoping for a cure of type 1 diabetes for my 5-year-old granddaughter and the millions of people who have type 1 diabetes. This cure of type 1 diabetes might come from Sana, might come from Century Therapeutics, or might come from a totally different company in the biotech or pharma world. Fingers crossed. So thanks for watching. This is Stephen Vig in San Antonio, Texas, hoping for a functional cure for type 1 diabetes.